Okay. Now, let's talk about compensation for a second. Take yourself away from ABGs. Don't think about ABGs for a minute. I want to take you to something that you probably already understand. Let's talk about blood pressure and heart rate. If my blood pressure goes low, so hypotension, what happens to my heart rate? So my blood pressure starts to go low. My body tries to keep me in that homeostasis area. If I just have low blood pressure and nothing happens, I'm going to feel really bad, symptomatic. A lot of issues are going to happen. So as my blood pressure starts to go low, my heart rate starts to go up. I start to have a faster heart rate because my heart tries to beat faster to compensate, to circulate that blood that's still there coming back to the heart. So low blood pressure, and my body compensates with making me have tachycardia for most cases. There's going to be some odd things that happen every now and again, with especially spinal cord injuries and neurogenic shock and stuff like that. But so your blood pressure goes low, your heart rate compensates and goes abnormally high. So hypotension is outside its normal range on the low side. Tachycardia is outside its normal range on the high side. That's because your body's trying to equalize you so that you're asymptomatic, you're doing okay. Your body's trying to compensate. Does that concept make sense so far? Sometimes, if the patient's blood pressure is going really low and their heart rate is going really high, they're still really symptomatic. So in that case, their body's trying to compensate. It's just partially doing it. It's just not effective enough. So sometimes you still have symptoms, but I want you to imagine a scenario where your heart rate starts to, or your blood pressure starts to go low, but your heart rate just sits there normal. Like, oh, I'm going to go and stay at 70. I'm good. So your blood pressure's tanking as your heart rate stays normal. Is your body trying to compensate in that instance? No, right? Because normally with low blood pressure, your heart rate goes up. Well, in this scenario I'm giving you here, your blood pressure is going down and your heart rate staying normal. So take those concepts of what we just talked about and let's try to apply it here with compensation. So in this first example that we talked about, you have a low pH and you have an abnormal CO2. So your CO2 is going too high because it's on this acidic side, and high CO2 means you're acidic, right? Because greater than 45 is acidic CO2. So this is going outside of its normal range. So if you're thinking about that analogy I gave you, think of your blood pressure is going low. So think of this as your abnormal finding here. But my bicarb's not doing anything. That's sitting there normal. So this is that scenario that I said, pretend, pretend like your blood pressure is going low and your heart rate's staying normal. Is your body trying to compensate then? No. Same thing here. Your CO2 is going out of range and your bicarb's sitting there happy as a clam normal. Is it trying to compensate? No. So you would call this one uncompensated. Uncompensated respiratory acidosis. Uncompensated. Because that guy is sitting there normal. If it was trying to be over here, if my bicarb was higher than it should be, if it was greater than 26 in this hypothetical scenario, let's say if it was 27 or 28 or higher, I would have put that HCO3 in this box instead of this one. And in that case, my body is trying to compensate, but it just hasn't fully done anything yet because my pH is still abnormal. And if that were to have been the case, I would be partially compensated. But in this scenario, this existing one here, your bicarb's sitting there normal, it's not compensating. It would have to be going on the other direction on this other basic side for you to say it's at least partially compensated. So on this example over here, it's something really similar. So we have a pH that's out of range, it's too high. We have a bicarb that's too high. And we've got this CO2 sitting here in the normal spot. So since this is sitting here in the normal spot, is it trying to fix the problem? Just like the low blood pressure and then the heart rate staying normal isn't trying to fix the problem, the same thing is here. The CO2 is sitting there normal. It's not trying to help and fix the problem. It's uncompensated. Uncompensated. Go back and rewatch that if you need to. I know that ABGs can be really intimidating. The more you practice, the better off you're going to be. So I'm going to probably cut this video. We'll start another one with some other practice problems where I can show you partial compensation and full compensation.